this is Dr. Erica Rushing, and this is a series of lectures on vascular and cardiac pathophysiology. I put these together years ago in preparation for step 1 for students because sometimes the pathophysiology is not covered in depth enough in preparation for the step 1 exam. So these go in order. Lectures 1, 2, and 3 for vascular, and lectures 1, 2, and 3 for cardio. So this is the very first lecture. Let's talk first about the vessels. The arteries are under high pressure. They have elastic and smooth muscle. The arterioles are the site of highest resistance in the cardiovascular system. That is a board's question. It's the arterioles that are creating the greatest resistance. An afferent arteriole takes blood to something, and an efferent arteriole takes blood away from an organ. The way I remember that is A comes before E, so the afferent takes it to, and the E comes later. Capillaries have the largest cross-sectional and surface area. That's really important. We'll be talking about that when we talk about equations. And they exchange oxygen, gases, and nutrients. Veins are under low pressure. The important thing to remember is that they carry 2/3 of the total blood volume, and that has a big impact when we start vasoconstricting or vasodilating the venous system. When we talk about equations, one of the equations we talk about is the V equals Q over A, or velocity equals the blood flow divided by the area. So what does this mean? It means that as we increase the velocity, we're going to increase the blood flow, because the blood flow, Q, is directly proportional to the velocity. However, if we increase the area, like we just said, the capillaries have a really big cross-sectional area, it will decrease the blood flow because it is inversely proportional to the blood flow. This is really good for gas exchange. We want everything to slow down so that we have time for the exchange of oxygen and carbon dioxide in the capillary system. So that makes sense. It works well. We always have to remember that this is a closed system. The amount that's pumped out of the heart on the left side is going to equal the amount coming back on the right side. I know that sounds like it's intuitive, but they actually ask about that in some boards questions because we tend to forget that the amount going out is going to equal the amount coming back. It's important to understand that flow is not the same thing as velocity. Velocity is speed. It's how far something travels per unit time. Whereas flow involves volume. It's an amount of volume and how fast that volume moves. So flow equals volume over time, which is depicted here in this picture here, where I have an amount of area that is moving over time. Flow is designated by the letter Q. In the body, we have to maintain the same flow throughout, the same volume moving, but we don't have to maintain the same velocity. We don't have to maintain the same speed throughout. Volume per second out of the left ventricle has to equal volume per second back to the right ventricle. So flow is a cross-sectional area times the velocity. And as we move into the system, we move from a small cross-sectional area of the aorta and its branches, and then it starts spreading out into a much larger cross-sectional area all at the same time as we move into the capillaries. So these capillaries are all in parallel, and this keeps the same flow throughout. As the cross-sectional area increases, then the velocity must decrease, right? So if we look at that in terms of arrows up here in this equation, if we increase the cross-sectional area in order to maintain the same flow, we're going to have to decrease the velocity. Slow velocity or speed is needed for gas exchange in the tissues, which is happening in the capillaries. So what drives flow? When we talk about how does the blood flow through the body, it's not just that the heart contracts and that contraction pushes the blood through. No, it's actually that contraction creates the initial pressure, usually about 120 millimeters of mercury, and it is changes in pressure as things flow down pressure gradients that actually drives the flow. It's not the actual value of the pressure that continues the blood flow. It's the difference in pressures as we go through the system. For example, in the aorta, it would be 120 millimeters of mercury. And then when we start moving down into large arteries, that pressure may drop to 110. And it's the change in the pressure that is going to keep the blood flow moving. Then when I drop down to the arterioles, it may drop down to 40. And then in the capillaries, it would be lower than that. And the venules will be about 15, and the muscular veins about 12, and the central veins about 7, till we come back to the right atrium, and that is somewhere around 0 to 5 millimeters of mercury. So we are constantly dropping pressures as we are moving through the system, and it's the change in pressure that is driving the flow. We can express this flow in an equation of the change in pressure divided by the resistance. And keep in mind that total peripheral resistance, TPR, is the same thing as SVR, systemic vascular resistance. So what does this mean? It means that the blood moves through the body from the high pressure generated from the left heart and moves its way all the way back to the lower pressure of the right side. Changes in pressure drive the blood flow through the body. And if I have an increased pressure difference, I'm going to have increased flow. However, if I have increased resistance, I'm going to decrease the flow because they are inversely related, as we see in the equation. The highest resistance is in the arterioles. We said that before. We'll be revisiting this again in just a couple slides. And when I hit the arterioles, I could have lower flow because suddenly I've increased the resistance. So what I need to do when I look at this equation, if I'm increasing the resistance by hitting the arterioles, I am going to have to increase the difference in pressure. I'm going to have a much bigger pressure drop when I hit the arterioles in order to keep the Q, keep the flow constant. This is just to remind you of the anatomy of the heart. We're going to be talking a lot about this coming up. Right atrium, right ventricle, out to the pulmonary artery. And just remember, the pulmonary artery carries deoxygenated blood. The boards love tricking you on that because as soon as we see artery, we think oxygen. But remember, the pulmonary artery carries deoxygenated blood, and it's the pulmonary vein that carries the oxygenated blood. Left atrium, mitral valve, left ventricle, aortic valve, out to the aorta. And then this is just a reminder of where you're going to listen to heart sounds, apartment M, and also Erb's Point. Circulation. When we talk about circulation, we have to remember that we're dealing with two capillary systems, not just one. We're dealing with the capillary system that's in the organs, and then we hit a second capillary system in the lungs. That's important when we talk about pulmonary emboli or any type of emboli. Can it get from the arterial side to the venous side? The answer is usually no, it can't, because it has to get through the capillary system to do that. We'll be talking more about that as we get into the cardiovascular later. So we said here's the equation. Q equals change in pressure over resistance. If I have resistance in a series, one vessel after another, they are added together as R1 plus R2 plus R3. This is important because as we move through the body, the resistance would keep increasing because we keep adding them in series. And eventually it would get so high that the blood would not be able to flow. But resistance in parallel is only 1 over R1, 1 over R2 plus 1 over R3. This is important because the branches off the aorta run in parallel, and they have a lot less resistance that way than if they were in series. As we mentioned before, to maintain the flow, when the resistance increases, our change in pressure has to increase too in order to maintain the flow. So we have to have a bigger pressure drop. This is just showing you a diagram talking about things being in parallel. When I have the aorta and everything starts branching off, they're branching off in parallel, so it would be 1 over R1, 1 over R2, 1 over R3, which prevents the resistance from building up too much. So in summary, what does the physiology tell us so far? The cardiac output equals the venous return to the right side of the heart. The blood flows through the body down pressure gradients from the highest pressure right beyond the aortic valve to the lowest in the right atrium. The arterioles are the area of greatest resistance with a really large pressure drop occurring, and large changes in pressure will increase the flow proportionally. So if I double the change in pressure, I will double the flow. So here's our equation. And as we said, to keep the same flow, if we increase the resistance, we have to increase the change in pressure. And this is showing you how that works. The aorta, let's say it's 100 millimeters of mercury, when it hits the arterioles, that has a huge drop down to 50 millimeters of mercury. Why? Because I have to have a huge change in pressure in order to maintain the flow when it hits the arterioles, which has a much higher resistance. Pressure decreases as the blood moves through the body back to the right atrium, and it's this continued pressure difference that helps move blood through the system. This is just to remind you about what the pressures are in the different chambers of the heart. Right atrium, anywhere from 0 to 5, 2 to 6, somewhere around there. Remember, the right ventricle has to have a change. It has to generate enough pressure to get above the pulmonary artery pressure to open up the pulmonary valve here. But it has to drop down low enough in pressure so that this valve, the tricuspid valve, will open, and that way the pressure in the right ventricle is lower than the right atrium, so the blood will move from the right atrium into the right ventricle. Same is true for the left ventricle. It's going to generate my 100, 120 millimeters of mercury to get a pressure above the aortic pressure to open up the aortic valve. But then it has to relax down and get below the normal left atrium pressure in order for the mitral valve to open and the blood to go from the left atrium into the left ventricle. Systemic and local tissue blood pressures must be maintained within a narrow range to prevent untoward consequences. So if we have too much pressure, it can rupture vessels and create a lot of damage. If we don't have enough pressure, then organs can basically get ischemia and die. And remember, the arterioles are the point of principal resistance to blood flow, and that large pressure drop is required. And this is showing it here in this diagram. These are our normal aortic pressures up here, the systolic, the mean arterial pressure, the diastolic down here. We need a huge pressure drop at the arterioles in order to maintain the flow to get through that increased resistance that occurs there. Capillaries, they are thin and they have a large area for diffusion of gas exchange. We already talked about that. Huge cross-sectional area will decrease the velocity to allow for gas exchange. And the reason why the arterioles have the greatest resistance is because they are controlling how much blood and the pressure going into the capillaries. If we didn't have our arterioles, we'd have way too much pressure going into the capillaries and the capillaries would burst. So these are kind of the valves that help protect the capillaries, and that's why they have the greatest resistance. So let's take a look at some examples on this change in pressure over the resistance. So let's suppose I have vessel 1 here, and it's going from 50 millimeters of mercury down to 10 millimeters of mercury. So my pressure change is 40 millimeters of mercury, also shown over here on the right. If I take vessel 2, it's going from 90 millimeters of mercury down to 10 millimeters of mercury. So it has a pressure change of 80 millimeters of mercury. And that's designated by the second equation. 90 millimeters of mercury minus 10 would be 80 millimeters of mercury. This change will have 2 times the flow because I have doubled the change in pressure. I went from 40 to 80, so the double the pressure change will double the flow. If I compare vessel 2 to vessel 3, 90 millimeters of mercury down to the 10, that's a change in 80. Vessel 3 goes from 180 millimeters of mercury down to 100 millimeters of mercury. That is also an 80 millimeter mercury change. So even though the pressures are very different in these two vessels, they actually have the same pressure difference. They're dropping by 80 millimeters of mercury. And so these two, vessel 2 and vessel 3, will have exactly the same flow because they have the same pressure difference. The change in pressure is both 80 in both situations. So keeping these pressure changes in mind, we can vasoconstrict or vasodilate certain areas and change the pressure either before or after that area that we're altering. So for example, if this is a glomerulus right here, and then I increase the resistance or vasoconstrict right after it, it's going to increase the pressure in the glomerulus before that constriction point. And it will increase flow through the glomerulus and cause more glomerular filtration. However, if I vasoconstrict before the glomerulus, then the pressure of the glomerulus is going to be much lower behind that vasoconstriction point, and I'm going to have reduced flow through the glomerulus and reduced filtration. So we said that if I double the pressure, I'm going to double the flow. The radius, however, is different. The radius is raised to the 4th power. It's r to the 4th. So if I double the radius, I am going to increase the flow 16 times. This is really important. The boards love asking about this, and I'll give you an example of how they ask it. If I double the radius, I will decrease the resistance by 16 times. So if I increase the diameter of a vessel, the resistance is going to go way down. If I increase the diameter of a vessel, the flow is going to go way up. So controlling the diameter of our vasculature has a really profound effect on blood flow. That's important when we talk about hypovolemic shock or anaphylactic shock and we get massive vasodilation going on. We're going to totally drop the pressures and our blood flow is going to basically slow down and decrease because I've massively vasodilated and now I have decreased the flow by 16 times if I doubled the size of the vessel. The veins are most compliant. They hold 2/3 of the blood supply, as we saw, and they can hold even more if they get dilated. As we get older, arterial compliance decreases further. The vessel can't give as much when blood is in there. It doesn't have as much compliance, and that can lead to hypertension. Increases in pressure increase the flow proportionally. 2 times the pressure will create 2 times the flow. Resistance in areas can cause changes in pressure and the flow before it or after it, like we just saw when we gave you the glomerular example. Increases in radius, however, are exponential. So if I double the radius, I'm going to increase the flow 16 times, and I'm going to decrease the resistance by 16 times. This is the equation that we use when we're talking about the radius. We're talking about viscosity, the length of the vessel, resistance, and remember, flow is directly proportional to the change in pressure and inversely proportional to the resistance. If we take all the components of this particular equation, as the viscosity increases, so is the resistance. These are directly proportional. And the flow will decrease because remember, flow is inversely proportional to the resistance. So as my resistance goes up, my flow is going to go down. As vessel vasoconstricts, right, that's going to decrease the radius. As this goes down, the radius goes down, the resistance is going to go up, And if I use this equation over here, as the resistance goes up, my flow is going to go down. As the vessel dilates or gets wider, the resistance is going to decrease and the flow will increase because it's inversely proportional to the radius. And this is just showing you the example of the vessels. If it's more vasoconstricted, I'm not going to be able to get as much flow through, versus vasodilated, I'm going to be able to have a lot more flow. If I have the radius, if I decrease the radius by 1/2, I increase the resistance 16 times. If I double the radius, I have 1/16 of the resistance. And this is just comparing the resistance in vessel 2 versus vessel 1. We just talked about this. The resistance will go down to 1/16, but the flow will be 16 times that of vessel 1. And again, another equation. This equation is just moving things around to make it in relationship to flow rather than in relationship to resistance. So flow is proportional to the radius to the 4th power. We need to keep this in mind as autonomic changes cause dilation or vasoconstriction and the effect it has on blood flow. So this is an example of a question of how the boards would ask you about this relationship between flow, resistance, and pressures. A patient has blood flow of 8 milliliters a second in a renal artery. Which of the following describes the blood flow in milliliters a second if the diameter of the vessel is decreased by 1/2 with no change in pressure? So we just said that the diameter is related to the 4th power when we talk about flow. So if I decrease it by 1/2, the diameter, I'm going to decrease the flow 16 times. So the question would be, what is 1/16 of 8 milliliters? And the way you would figure this out is that you would then say, okay, I have 8 milliliters a second times 1/16 would mean 8 divided by 16 milliliters a second, which would give me 0.5 milliliters a second. And that would be the correct answer, 0.5. It's 1/16 of 8 milliliters. When we talk about turbulence, turbulence is related to the diameter times the velocity times the density of the blood divided by the viscosity. So to have turbulent flow, I'll have more turbulent flow if my diameter is increased, if the velocity is increased, the density is increased, or the viscosity is decreased. So when we think about this, the aorta has the biggest increased diameter and also increased velocity. And in a situation where I have anemia and the viscosity is low, I could hear murmurs in the aorta because of this equation. There's more turbulent flow. It's one of the largest vessels, so the diameter is high, and the viscosity would be low in anemia. The blood is thick, it's much thinner. So both of those situations can increase murmurs that I could hear in the aorta when a patient has anemia. Remember, the aorta is more susceptible to endothelial damage, and it is the most common site of atherosclerosis. Students tend to mistakenly put the coronary arteries, because you think coronary arteries and atherosclerosis and myocardial infarctions. The most common site of atherosclerosis is the aorta. The abdominal aorta is the most common site. Another equation, compliance equals volume divided by pressure. As odd as it sounds, the more elastic and thicker a vessel is, the less compliant it is, the less give it has. So the veins are actually the most compliant. They're more compliant, they can hold more volume at a given pressure, and that's why they hold 2/3 of the blood volume. As we age, the arteries become more stiff, the compliance goes down, and the pressure goes up based on this equation. This is just a reminder slide to remind you of what you need to know. Okay, the boards love asking about these. You need to know what vasoconstricts and what vasodilates. They expect you to know these, and they're going to give you situations where they give you one of these entities, and you need to know that aldosterone vasoconstricts, or you need to know that histamine vasodilates. And they expect you to know that to answer the question. So this is just a quick summary slide of those entities that vasoconstrict and vasodilate that the boards like to ask about. In summary, cardiac output needs to equal the venous return to the heart. Changes in pressure, resistance, velocity, and area keep the flow constant. The blood flows through the body down pressure gradients. The arterioles are the area of greatest resistance. The fact that the capillaries are much larger surface area slows down the flow for gas exchange, but it still remains constant. The flow is constant. It's the velocity that drops. Increases in pressure increase the flow proportionally. If I double the pressure, I will double the flow. Resistance in areas can cause changes in pressure and flow before it or after it. And if I double the radius, I will increase the flow 16 times. If I half the radius, it will go down to 1/16 of the flow. If I double the radius, I will have 1/16 of the resistance. And if I half the radius, I will increase the resistance 16 times. Controlling the diameter of vessels has a profound effect on blood flow. Keep an eye on the aorta. It has the highest velocity, the largest diameter, and so it will have turbulence first. The veins are the most compliant, hold 2/3 of the blood supply, and as we get older, the compliance decreases further, and it increases the pressure, which leads to hypertension. And that is the end of this first of the series of 3 for vasculature, and then there's another series of 3 for the cardiac, especially the cardiac function curves and the venous return curves.